The Internet of Things is going to transform all companies that adopt these technologies. We've already seen companies that are leveraging IoT to become more efficient, more profitable, and also more personal. They can have a much more engaging relationship with their customer. But I guess when we look at all these sectors, we look at banking, we look at retail and insurance, the one sector everyone cares about especially is healthcare. We as people and family members, we want to become healthier. People are living longer. So how can IoT make us live longer and be healthier? The IoT healthcare market is massive. I think it's predicted to $117 billion by 2020. Whether you believe analyst figures or not, that is a huge market. And at this year's MWC, that's Mobile World Congress in Barcelona, everyone was talking about IoT in healthcare. Ericsson, Intel, AT&T. Everyone wants to cure the healthcare problem, and that is they can't innovate fast enough. They don't have the money to innovate. So we were here at the Internet of Healthcare to ask a key question. How can IoT change healthcare and improve healthcare by 2020?
It would change it immeasurably. IoT is the key for the future. We're living in exciting times, Doug, because at the moment with IoT, what does it mean? It means the interaction of biosensors, remote monitoring, AR, VR. It's about big data, big pharma, nanobiotechnology, all the interfaces that are required to improve healthcare. And IoT encompasses everything and will be part of healthcare going forward, and it'll be intimately linked with patient outcomes.
I think IoT, if by 2020 and more so by 2025, would change the way healthcare is delivered dramatically. And from a very personal point of view, as most of us become older and we cross the age of 65, 70, we will have chronic diseases. We can't escape that. And we should expect to be fitted out with all sorts of devices which are monitoring that. And we should expect that data to be going to some cloud where analytics will play an important role. And then finally, we should expect a synthesized version of that data to go to a doctor who will remain our interface. A doctor will remain, and I don't predict that in the next 10 years, the doctor is going to disappear from the equation. That's not going to happen because human beings trust other human beings, especially for their healthcare.
We will get to a stage where people will have all of this information at their fingertips. They will not need to, they will be able to have instant access to doctors around the world in order to be able to, with their medical records shared, or they will be sharing their medical information in an appropriate way so consultations can happen in much more rapidly than they happen at the moment. This idea of having to make an appointment is going to go out of the window. It will all happen online. Everything will be online.
We've seen quite a lot of change in the last 5 years as how technology could improve the quality of life. I'm hoping that by 2020 I will be able to provide much better care for my patient while they're still in their home, not in hospital. This doesn't mean that we reduce a sort of a contact, but it means that we will see people that they need to be seen, not just a routine outpatient appointment.
By 2020, probably a lot of chronic patients will be equipped with monitoring systems at home. I think that more and more the monitoring systems will disappear and they will be very transparent. I think that one of the issues is for chronic patients not to feel that they are chronic patients. I think that the captors are going to go inside the clothes, inside the beds, inside the cars, and that it's going to be very transparent for patients. Probably a lot of information will flow from those monitoring system to the doctors, and will be processed all the time.
I think the most important contribution of IoT in the next 5 to 10 years is that it will allow people to stay at home as they become older. It will allow them to be cared for at home with less clinical intervention, less intervention from social care, and it will allow both carers and family members to stay in touch with the elderly population. And I think this is probably the most important population for us to focus on. Keeping the frail and elderly at home is the most important thing we could do for them. They tend to have poor experiences of healthcare today. It's also the most important thing we can do for the taxpayer.
I believe IoT in healthcare, it will move very, very fast. But in terms of healthcare as a whole, new models will be created, I believe. But I think now we have to stop and think how we can move on effectively and fast, because it seems like we're moving fast, but the major impact is yet to be palpable.
This will be driven by clinicians, I think in particular community providers who know the most about pathways that cross primary care, secondary care and residential care. So I think it's the responsibility of community providers who already have district nurses and social carers working up to the CCGs and the local authorities to both train staff but manage the data and also enable the money to flow in a way that can fund these innovations.